I love it.
Hey, welcome to the Honey and Harry Show.
And who are you?
Honey and Harry. Wait, what?
Go ahead and talk, honey.
Okay, I'm sorry. Well, there's Harry. I don't
Yeah,
know.
that's me.
Yeah.
I'm pushing buttons and turning dials.
I know. We're having all kind of technical difficulties,
say.
Dad.
No, we just got some noise going, so.
Yeah, because that's going to distract me, so we need to get that fixed. But anyway.
There you go. Now it's gone.
I'm sorry. Now we bring my special guest on, and you have a complication. That's okay. But anyways, welcome to the show. I have two really special guests today. Brady and Tammy. That's mother and daughter. Brady, we met Brady, I guess, through at St. Joseph's when Peanut was playing soccer with you. Brady's going to kind of come on today and talk about the BRCA gene. Brady, I think I read in your blog, you found out that you were, I think you got tested. Were you in high school? When
I was in college.
You were in college,
yes, sophomore year.
Was it 2017?
2017, exactly.
That's so long ago.
I
But
know.
yeah, okay. So I thought it was later on, but I've read her blog, which is, we're going to get to that in a little while. We want to definitely put your blog on so people can see.
Yes.
But anyway, so she ended up with the BRCA gene. You ended up getting the double mastectomy.
Correct. Preventative double mastectomy for the BRCA gene. Yeah.
For the BRCA gene. And you did that after college. But we're going to go into all that. But I wanted Brady here because I feel like breast cancer is running rampant right now. It's crazy every day. It's somebody, and and cancer just in general. So I kind of brought you on to educate everybody because you're such a smart girl.
Oh, thank you.
And I love you so much, and I'm so glad that you came on too, Tammy.
Yes.
And Tammy's going to help her explain some of the family history and all that.
Yeah.
So kind of just tell us a little bit about your story. Get started. Like why you even got tested, because some people want to know that. And the only question, I know I'm rambling on, but should everybody get tested? That's a question, even if it's not in your family. Because, Dad, with me being adopted, I don't know my family history. We don't know it. We don't know anything about it. Should we just go ahead and start doing that when we're young? I don't know.
Yeah, no, and I'm glad you asked that question first. I do want to start with, not a medical professional. I do not have a degree dealing with cancer. My mom and I do have medical backgrounds. I'm a physical therapist. She's a speech therapist. So anything I say is knowledge from doctors that we've seen. I've seen that have dealt with cancer, any research that I've done, because I do try to keep up with research dealing with the cancers. But I mean, I definitely think a lot of people should get tested for anything genetic wise. There's so many things that we don't know about, even just besides the breast cancer genes out there. Our families, our parents, they don't always get tested. So you never know. There's new things coming up in medicine all the time that we're figuring out. So I don't think it can hurt anyone to get genetic testing. I don't know, there's definitely some caveats with getting tested, and is it the right move for you? Because it's not the right move for everyone. And I'll get into that later, I think. But
and also just the financial piece of it. It's not cheap to get that done.
Correct.
So
and insurance will only cover people that have a higher risk as well. So
Oh, really?
that's something to look at as well.
I didn't know that.
Yeah. But I definitely think it's something that everyone should look into.
Yeah, because I always tell, Lindsay and I always say this, because we see Dr. K, we see all these different people, but you pay now, you pay later.
Yeah, exactly. I love that.
So,
quote.
it's like you want to, because, chemo costs a lot of money.
Yeah,
You know what I'm saying?
No, it's true.
Even if the genetic testing is $1,000 or $1,500, you're going to spend that anyway.
Yeah,
at some
that is
point
so
in your
true.
life with medical. I mean, I don't know. It's your body. I mean, you take such good care of your car. And you watch the gas you put in your car and change the oil. Our bodies need to be treated the same way.
Yeah, our bodies are
crazy.
temple.
No, you're absolutely right about
and we
that.
don't treat our bodies, and we don't test. And it's a shame that the insurance won't pay for that for some of the, for people who can't do that.
And we'll get into it later too about
absolutely.
Who's more at risk. But I definitely, like I said, I definitely believe that everyone should look into it and talk to their doctors about it.
Because you were how old were you when you got tested?
19.
So I was 19.
Yeah.
19.
I was 19 years old.
19 when she found out.
Yeah. But I do want to talk about the BRCA gene and what it is first, because I think people don't know what it is.
I'm going to be honest with you. It's so crazy, because I told Tammy and Brady when they walked in, I was like, I didn't. I really wanted to do a show on this because, like, Lindsay didn't have it, so we were just on to the next. What did Lindsay have?
Right.
What can we do to treat Lindsay's, stop Lindsay's, all that.
Right.
So, like, this is huge.
Yeah.
Yeah.
You're 19 years old.
Yeah.
Yeah.
What really explain it? Because
Yeah.
I even went and looked it up, and I still don't understand.
Yeah, I know it is confusing. Well,
It's confusing.
that's what I was going to say too. I mean, the people that even know about the BRCA gene, there's a lot of misinformation about it. So, to start off, the BRCA gene stands for breast cancer gene. So BR from breast, CA from cancer gene. And even though I am BRCA positive, that doesn't mean I'm positive for the gene. It actually means I'm positive for the mutation. So everyone actually has the BRCA gene, and the BRCA gene is a good gene to have. We all have a BRCA1 gene and a BRCA2 gene. Their roles are to suppress tumors and to repair DNA. So it's good to have the BRCA gene. To be positive means that you have a mutation in the gene. And what it means to have a mutation is the gene can't do its job. So because I'm BRCA positive, my gene cannot suppress tumors as well, and it cannot repair DNA as well. And that's why I have an increased chance of getting a couple of cancers, is because my BRCA gene does not work like y'all's does.
That's crazy.
So that's even information that people don't know about.
You made it very simple.
Yes.
Because you go
I
on the
tried
Google and it's like, what?
Yeah, the Google was. Yeah.
It's confusing because again, the wording BRCA positive, you think, oh, you have the
You
gene.
think it's a bad thing?
Yeah.
And it's not. It's
It's
like
not.
you're just positive for the mutation. So that's the beginning part.
Okay.
And then the second part of that is the next question I always tend to get is, okay, so how do you get the BRCA gene? How do you know if you have it or not? And yes, yeah. So,
There it is.
so everyone has a BRCA1 and a BRCA2 gene. So I'm about to use the diagram in a second. But everyone gets a BRCA1 gene from their dad and a BRCA1 gene from their mom. They also get a BRCA2 gene from their mom and a BRCA2 gene from their dad. So if we look at the graph, we're going to use the Bs, all of the Bs, as the BRCA1 gene right now.
Okay.
You mean the capital B's?
Nope, all of the Bs.
All the Bs.
All
Okay.
the Bs
Okay.
and that. So the male in this situation has 2 normal BRCA1 genes. So that means that his dad and his mom both gave him a BRCA1 gene, and both of them are normal. So that's good. No mutation. The woman in red at the top, she got a BRCA1 gene that was mutated either from her mom or dad, and then she got a normal BRCA gene from the other parent. So let's say the dad gave her the mutated one, which is the capital B, and then her mom gave her the normal one, which is a lowercase b. So this gene is a autosomal dominant gene. So all it takes is one bad BRCA1 gene.
Wow.
Love
that you brought this.
No,
I'm so glad Brady brought this. I'm so glad you did.
No, it's
Back to
easier way
biology.
to
I know, we're in
explain.
class.
Yes, we're back in class.
Now you're teaching.
Yes,
I
back to chemistry and
Yeah.
genetics and all
Yep,
that.
yep.
But anyway, so each kid, because of this pair, so the mom is BRCA1 positive for the mutation, and the dad does not have
Does
the
not have the
BRCA mutation.
Okay.
So all of their kids have a 50% chance of getting the mutation, as you can see. So,
Wow.
2 of the kids there have it and 2 of them don't. And you have a 50% chance. So my mom's going to kind of tell the story of our family and how we got it. But just so everyone knows and understands, you can only get your BRCA gene from your parents, and it cannot skip a generation. So as you can see, one of the kids at the bottom, either of the white kids, not the red kids, they cannot have a kid with the BRCA gene. Unless they marry someone with the
if they
BRCA
marry
mutation.
someone.
Okay.
So that's
But
very
it won't
important.
come from them.
It will not come from them.
Okay.
So it cannot. I get asked that a lot as well. It cannot skip a generation. You have to directly get it from a
From
parent.
a parent.
Wow.
So,
I know.
so that's the BRCA gene. So now we can talk about fun stuff of the
So-
journey.
So what happened with our family, so my husband's mom passed away when he was 16 of breast cancer. So she was 40. She was very young. And at the time, of course, just devastating and all, but they didn't know a whole lot about cancer. But in an interesting way, she had a lot of family members that had already passed away. her 2 aunts, so her mom's 2 sisters, had passed away from cancer,
Wow.
and one of their daughters had.
Was it breast?
It was
of
all
them?
breast.
Really?
All breast.
Some were ovarian.
Somebody did have a variant. I'm
Somebody
sorry.
did have-
Somebody
We're
did have
not
a
as
variant.
sure, sure.
Well, you
the-
know family history, but
Yeah,
we
no,
don't-
no,
one
but that's-
did,
it's
but
so hard.
definitely lots of breast
But
cancer.
that's a lot.
I know.
Yeah.
I know. And so she died at 40. And then she has 3 brothers and a sister. And her sister, and again, this is, in the 80s. And so she gets the treatment and it comes back and eventually passes away. Her sister, who's younger than her, a good bit younger, by the time she's approaching 40, she's positive for cancer.
Oh my gosh.
So anyway, so we know there's a lot of history. We know that my husband's mom and her only sister passed away by when they were 40, and then some aunts and cousins.
And also, I'm just going to pause you for a second. We know too, these are people that are very young, like Lindsay. These people are getting diagnosed in their 30s. So the
and that was
likelihood.
unheard of in the 80s.
yeah.
Very unusual.
Very unusual.
And his mom's first diagnosis, I think she was like 32 or 33, very young. So,
And the chances of breast cancer being genetic when you are diagnosed before the age of 30 increase by like 40%. So it's not, they're looking at things, it's not environmental necessarily. There's not other things that are like the percentage or the likelihood that it's genetic is really high. So my dad had all these women in his family and they were diagnosed at a young age.
yes.
And that
all
is
diagnosed before 40.
that is a
right.
big indicator of BRCA, which we'll get into later.
So anyway, one day I'm talking to a friend of mine whose husband kind of has the same family history. His mom died when he was young of breast cancer. By then, he has 3 sisters too. One of them had passed away. One of them had breast cancer. And so we were talking about the genetic, possibility. And she said, well, my husband got tested and he doesn't have the BRCA mutation. So, and they had 4 girls of their own. So
wow.
we're clear. We're not as worried about the girls. I said, okay, that's good to know. And I tucked that piece of information away. The girls were still pretty young
it was like
at the time. They were like in, late elementary school.
Yeah.
2012-ish.
Brady in high school then had something that she needed to see an endocrinologist about. And so we went and saw Dr. Silverberg, and he's doing a big old history. And, we have to mention about Mike's breast cancer.
Oh, wow.
And so afterwards, after he treats her for what, we had gone to see about, he looks at me and goes, now I want to talk to you about your husband getting tested. I said, my husband getting tested? He said, well, I'd like him to get tested for the BRCA gene because of his family history, and we'd like to know it for Brady and Molly. And I was like, oh. And so at that point, I started telling my husband, Mike, I'm like, I think it's time to go ahead and get tested simply for you to know, because he's at high risk for cancer, but for the girls for sure.
And that's such a good doctor.
Yeah.
Because nowadays, lots of times doctors just push you out.
Yeah, they do. And he did. I mean, he stopped me immediately and said that was before we left his office. He said that.
And he told him told you as well, if Mike doesn't have the BRCA mutation, then we don't have to worry about it.
Yeah, we're just
because one question I think Dad had was, well, why do I need to get tested? Just get the girls. And it's like, well, number one, you have an increased chance of several cancers. But number 2, if you don't have it, then we don't need to get tested. Just like family friends.
He just does it.
He needed to. So he got tested, and sure enough, it comes back positive. And so I told the girls, I said, when y'all are ready. So Brady and Molly, who's 2 years older than Brady, went together to Dr. Superno, and they got tested. And I don't know why. I just, I'm praying that neither of them have it. But I was like, I think one of them's probably going to have it. And if I had to guess, it was going to be Brady.
Really?
And I knew it was going to be Brady for a couple of reasons. Number one, I know we're giggling. It's kind of funny. One of the reasons I knew is she looks so close to her. I mean, Mike's family, she's got a lot of Mike's family's genes. Like she looks a lot like his side of the family.
Especially
so
his mom.
His mom, exactly.
Really?
Like his mom. And also, I knew she could handle it.
Well, Brady's tough. We all know that.
My oldest Molly's strong and she's wonderful, but it would have just been a different.
And Molly says the same thing.
And Molly will tell you the
Molly
same
says the
thing.
same
So
thing.
anyway, so
now you know your girls.
I know my girls.
You
And
know
so,
your
but I
girls.
prayed. I'm like, you know what? I'd love it to be negative for both of them. And of course, it came back positive. And it's a gut check, because then you're like, okay, so. And knowledge is power, and I'm glad we have the knowledge we do.
Thank
so thankful.
God.
If
We is such
mom
a
had
blessing.
this, you
It's
know,
such
which
a
would have been a
blessing.
different thing for
Yeah,
her. And so
I know.
anyway, so Mike is one of 4. He has an older sister and then 2 younger brothers, biological in his family. And then so his sister has gotten tested and she is negative. And his 2 brothers are going to get tested. They just haven't yet, but they're going to. So.
Well, good. But that
Anyway.
is so crazy that, like, I just didn't know
Yeah.
how it runs.
I
Like,
know.
I just did not
I
know
know.
that.
I know.
Well,
And,
and people
know.
always assume.
and I never even, like, when they told me, I was like, why do I need to get
Why do I
tested?
need to
Because
get
she
tested?
doesn't have it. And they were like,
Right.
you have to get tested.
Right.
And Peanut had to, too.
Right.
And Peanut didn't want, Peanut.
Yeah,
She
I
didn't
know.
want
He
to.
was like, well,
Yeah,
I
I
don't
know.
know.
But I made her do it.
Yeah.
And neither, thank God, neither
Yeah.
one of us had it.
Absolutely.
But that's still, like you said,
right.
doesn't mean you're in the clear.
No. No.
But what
No.
other cancers? So, like, I was reading something too, and I'm going to ask y'all because I just don't know.
Yeah.
Do men can get breast cancer?
Mhm.
So
could
Mike's
your
at increased risk. Oh,
so
yes.
he is.
Yeah.
He is.
So does he get? He has to get checked,
Well,
right?
that's a funny story. He should be getting, breast exam mammograms because he's, we're in our 50s now, but he has not, but he should.
He should.
But I just kind of tell him, kind of keep an eye on things if anything feels funny. But I think his risk, tell me if I'm wrong, it goes from 1% to 2%.
Yeah.
Oh,
It's still
different.
Yeah.
over your lifetime.
Yeah.
That's the other thing. I
So,
know
yeah.
Brady will get into this, but your risk of breast cancer, if you have the BRCA mutation, it's a percentage that Brady will talk about, but it's basically an over your lifetime percentage.
Yeah.
Okay.
So, like, it's not that, at this one moment, it's that over your lifetime, this is your chances of getting breast cancer if you have the BRCA mutation. So,
But you never want to get it.
No. Oh, yeah.
And
no,
that's
yeah.
the thing. You
Yeah.
never.
no.
And I didn't understand that. I'm glad you said that with
Right.
the over the
Right.
lifetime of it.
You would
Okay.
Yeah.
like to not have it. Right.
Yeah.
Yeah.
Well,
but-
and I mean, now would be a great time to kind of chat about. So, there are 4 known cancers that are
That's what I wanted to know.
associated.
Yeah.
Because that's like the big question. Again, it's the breast cancer gene. However, there are 4 cancers associated with it, and it affects men and women. So breast is one of them, and it affects both men and women. A lot of
Okay.
people don't think that.
Yeah.
The pancreatic is another one.
Oh wow.
Don't know about that as well. Melanoma is the 3rd.
Okay.
And then the 4th is ovarian for women and prostate for men. So kind of how I explain it and how it was explained to me that makes sense is, every year that you're alive, your chances of getting cancers increase because you're constantly being exposed to more abnormal cells and all that. So if we look at breast cancer as a good example, women that do not have a risk
Like
at
me.
all, like my
Or
mom.
like you.
So no
Yeah.
family history
Yeah.
that my mom has of breast cancer.
Lindsay.
Yeah, well, I know.
Lindsay.
Have up to a 13% chance of getting breast cancer over a lifetime. So that means that every year you have a little bit more of a chance of getting breast cancer, a little bit more. And it can get up to 13%.
It doesn't mean everybody can get
No.
up there, but
And
Yeah.
other factors, come into that. So lifestyle, what you're putting in your body, like we said about nutrition, exercise, all of those things factor into it as well. So it can increase, decrease, but on average, someone like my mom, it gets up to a 13% chance. So if you look at the BRCA gene for women, we have, and we've chatted about this a lot, the research still isn't,
100%
conclusive,
Yeah.
but it's about a high 80s, so 87, 89% chance over a lifetime. But what looks different in someone like me with the mutation is every year my chances increase and they double and they double and double. So my chances of getting to 89 are a lot faster than someone else's of getting to 13. And that's why they say with the BRCA gene with breast cancer, it's not, if it's when. Because if you have up to an 89% chance, you're going to get it. And you're most likely going to get it sooner than later. And that's why I think a lot of people in our family, or my dad's side of the family, not my mom's, but they got diagnosed in their 30s.
Well, yeah, they could. I mean, they didn't
Exactly.
know.
Yeah.
Just didn't know.
And that's just the genetic
I mean,
part
thank
itself.
God you know.
Yeah,
Mhm.
exactly. I mean, we're so
So,
lucky. about it.
knowledge is power. I
It
say
is.
so
No,
breast-
it totally is.
Yeah, and breast cancer, so that is the highest percentage for women. For men, like my mom says, it jumps to a 2% chance.
Yeah.
For ovarian cancer, I have up to a 45% chance. And there's new research looking at, they don't even know if it's actually ovarian. They think it starts in the fallopian tubes.
What?
So it might be fallopian tube cancer, not ovarian. It just is, we don't catch it till it's ovarian. So that's something to look at as well.
I know.
Pancreatic, you have up to a 5% chance for both women and men. Prostate, you have up to a 60% chance.
Oh, wow.
For BRCA2, and for BRCA1, it's about a 10% chance. And then melanoma, you have up to a 2 to 5% chance. And again, this is all new stuff.
That is
but
so crazy.
those are 4 big cancers that I mean, those are huge. So it's not just breast cancer.
Yeah.
And there's actually new research out there in the past 2 or 3 years. So the BRCA mutation was found, we discovered it in the 90s, and now it's 2024. And it wasn't till 2019, 2020 that we're discovering that there's some research looking at esophageal cancer, gastric, biliary duct cancer that are associated with people with the BRCA mutation. So we're
This is
just
great.
constantly learning new things.
Are you just like,
I
oh
know.
my gosh.
Yeah. Well, and thank goodness, she's so on top of it. And
No,
she gets
she
all her
is.
screenings
No,
and she
you are.
stays informed. I mean, the minute she got, tested, appointments were made. We were on it with what to do.
No,
So,
100%.
I
And thank
know.
God you have your parents.
Oh, yeah,
too,
no, I
that
mean-
you're good parents that are
And steered
helping
me
you.
in the right direction.
Right.
As y'all heard, I mean,
'Cause
I
you
was in high school whenever
Yeah.
Dad got tested and all that, and
Yeah.
it wasn't something I just came up to my parents one day and said, "Hey, I want to get tested for the
No.
BRCA gene." They educated me, and
Absolutely.
definitely were
you
big
need mom
supporters.
pushing.
Yeah.
Yeah, you do.
And I told
It's
them,
so
I said,
important.
y'all don't have to
Yeah.
get tested. I
And
said,
what-
you don't have to. But I mean, I felt like they should. I'm
Oh,
like,
you're such a good mother. I would
you
be
would
like,
have said you have to.
Well, and what's awesome about my mom, and I'll quote you because you've used this quote a lot for not only my sister and I, but patients of hers. But when you go to get tests, for anything, so whether you're going to get tested for a learning disability or genetic testing or anything, she always asks and tells you to ask yourself, what are you going to do with those results? And I think that's a really important question.
that
Yeah.
is.
And that goes back to what
That
I was
is.
saying earlier to you about some people would get this diagnosis and get freaked out and live in a lot of anxiety.
Absolutely.
So
You know?
then if you're not going to do anything and it's
I
going to give you
was-
anxiety, then
Then maybe it's not the
maybe
best
it's not
thing
the
to
best
do to
thing.
get tested, and maybe just get preventative measures. But Molly and I both sat down in college, my sophomore year, her senior year, and said, okay, if you're positive, what are you going to do? And she was like, if you're positive, what are you going to do? And we both were like, we have the science and the medicine to do preventative stuff. And we've seen so many people suffer from cancer in opportune times. And so we were like, we want to do this and we want to be proactive in our health. And so,
So y'all both decided y'all would do the double mastectomy.
yeah. No, the BRCA.
The
No,
testing
the-
for-
I'm
yeah,
sorry,
yeah,
the testing.
yes.
But did y'all both decide?
I don't
Like
think that y'all knew
did
but
you-
then what you would do if you
If
were
you-
BRCA
if you were-
positive.
if
Oh
you were
yeah, no,
positive.
we didn't think that far.
Brady, that was so, because I'm going to tell you, like you were so brave because you were so young and people
Thank you.
don't understand. And I know young girls understand. I mean, when you get to be my age, you're like, you don't care. I mean, and not that you don't care, but it's not,
Right.
it's different.
Oh,
It's
right.
just,
it's
it's a totally
yes.
different thing. But like when you're so young, you're in your 20s
Yeah.
and
In college, having fun.
yeah, no, seriously.
yeah.
Like I was so amazed, and I'm going to say this too. I came over to Lindsay's house. I'm going to tell the story. I came over to Lindsay's house one day, and it was right after Lindsay. I think she just had it.
Yeah, she just had her surgery,
Uh-huh.
her mastectomy.
But
and
you had yours in January of
yeah, I
that
had
year.
it in January, and then my reconstruction was in May. And so,
So Lindsay
yeah.
was how
So
far after that?
I think Lindsay got diagnosed in May.
Yeah, she got diagnosed in May, but she had her surgery in June, I'm pretty sure.
I think in June.
Yeah.
But today, I think they did it before. It's such a wash.
She did it before chemo.
Chemo.
Yes,
She did do it
correct.
before
Yeah,
chemo because she had the spacers in.
She had the spacers
after
in.
she did it with the reconstruction. So she
correct.
remembers, but
Yes.
everything was a blur.
You probably, I mean, you were just
Because you're
trying
just-
to take care of kids.
Well,
and
and take care of kids and just
Yeah.
the stress.
Yes.
stress.
And it's-
Oh,
and just
it's
the
a
scary.
lot. And,
Yeah.
and
Yeah.
y'all did have the cancer to deal with too. Like y'all had the chemo and
Well,
the,
not, yeah, that's the whole
You
thing.
know,
but
yeah.
like again, if
Yeah.
Lindsay would have had, well, I'm not saying she didn't have the BRCA gene, but like still, breast cancer wasn't even on my radar.
Right.
Yeah.
Right.
Yeah.
You know
No,
what I'm saying?
I do
know that sounds
understand.
so ignorant. I mean, like it wasn't even on my
of course
radar.
not. It's
But
not
Lindsay,
on-
Lindsay was like you, like Peanut. athletic,
Right.
athlete, always was an athlete. Y'all
Yeah.
grew up playing sports. You know,
Yeah.
I mean,
Yeah.
my kids were constant, like your kids.
Exactly.
They're always doing stuff.
Oh,
You were
yeah.
always feeding them good.
Yes.
You know, we were always mindful. They were working out with Nate.
Yeah.
Oh, yeah,
I mean,
Nate
you
Black.
remember
Oh,
Nate
yeah.
Black?
Black.
I mean,
Oh, yeah.
Oh, yes.
It
Yeah.
wasn't like we had kids that were couch potatoes.
Right.
And
No,
we
you know,
weren't the ones smoking weed in
smoking
college,
weed,
drinking all the
I know,
time.
and
you know?
marijuana.
Yeah.
But for real, like those are factors.
No,
and we
y'all weren't doing the
them.
drugs or none
No,
of that.
no.
I know. I told Lindsay one day, I was so mad. I said, "Well, you should have just lived,
Just done it.
done everything, and just
Put your
yeah,
chance
because
out.
more thing." But no, but y'all. I mean, that's the other thing.
Yeah.
Like, but when I walked in, and I just walked in, I think I had the kids, and you're sitting there taking care of Lindsay, and you're 23, she's 29, and I'm like, this is not right.
No.
This is not. And thank
no.
you for doing that. And I'll
Yeah,
never,
no.
ever,
Yeah.
ever forget that. Because like you gave her a comfort and you just came in and she just took
Yeah.
charge
Yeah.
and
Yeah.
she just
Yeah.
acted like it was no big deal. You were laying on the couch talking,
yeah.
you know, she's got the kids. I mean,
Yeah.
she just was part of the family.
Right. Right.
You know,
I love
and it was like
that's
that-
Brady. Yeah.
That was a gift.
Yeah.
Just to
No,
let you know,
yeah.
and Lindsay talks about that was
Oh.
such a gift to her
Oh.
at that time because like she didn't want to talk to people my age.
Yeah, no.
You know what I
yeah.
mean about that? It
Yeah.
was like you.
Yeah.
Yeah.
Y'all could really. Yeah.
Well,
no,
and
I
that's
agree.
been, you know, a lot of people tell me like, oh, you know, it's so unfortunate you have the BRCA gene, but it really has been a gift in certain ways for what you just said. Like, I had, you know, information and experience. You know, it was different than Lindsay's. I did not have cancer, but I did go through a surgery like she had, and so I was able, you know, to talk to her about it. And like you said, it was probably something small I said or something little, but I can
But it was
give that to
huge.
someone else. And I think the
Just even
most-
like the bathing or the
Yeah.
the
Yeah.
drains,
The
what you do with
pillows.
Yes.
anything.
the pillows,
Yeah.
what to do,
How to get comfortable.
Yes, how to get comfortable.
People
Yeah.
don't understand that. You
No.
get that off, and it is not
Yeah.
fun.
No,
Yeah.
it's not. And
No.
yeah, and that's been
Well, it's a lot too.
there's a
It's
lot going
lot.
on.
You know.
It's a lot.
It is.
It is.
But she was like
Yeah.
a mom in
Yeah.
there.
Yeah.
You know,
well, and
rock star.
It's
Wow.
thank you. You're so
Aw.
sweet. But yeah, no, I mean, it's comforting to have someone who's been through
through
an
it.
experience.
Yeah.
And again, not that I had cancer, but at least I had the, you know, and I'll get into it, the prophylactic double mastectomy, so I can at least help people out, because it is so comforting when you're going through something like that.
It is.
To hear someone that also has gone through it. I mean, I know she loved having you by her side and Peanut and all these. I mean, she has an army. She really does, of people who love her and are there for her. But it's something to be said when you have someone that has gone through the same thing,
Absolutely.
and the cancer community for her
Yeah.
too in Baton Rouge is
It's
so
just
strong.
So strong.
It
So
is
I
so
mean, I know
strong.
I connected her with someone, Becca Bartlett, that she had cancer, and I told Lindsay, I was like, "Look, I don't have cancer. You know, and so maybe finding someone that does have cancer, had cancer, that even is comforting as well when you're going through all this.
Oh, when you're
Yeah.
going through it, you're just so lost.
Exactly,
Oh,
you
God.
are.
It's so
And-
Well, it's
and-
I mean, you're just like you said. You're just trying to make sense of things.
You can't.
Yeah.
You can't. But like,
No.
and I think you being brave and doing, and I think that was the right thing to do. Don't
Yeah.
you? Getting
Well,
the
and
double mastectomy. Just
I absolutely
It-
think.
it-
Do you want to walk her through though? How
Oh
you
yeah,
decided
yeah.
that?
I guess
yeah.
I'll
Tell
walk
me
her
how
now.
you do. It's
I
like
know.
you can't
Because
just like.
here's this
I'm
young
thinking of
person.
myself.
Yes, exactly.
And I mean, I don't.
It'd
I
be a
mean, like
big
that
decision.
has to be
Yeah.
just scary as can be.
Yeah, no, for sure.
Look at my cousin Abby.
Oh.
Sometimes the greatest gift
Oh.
of our struggles is being able to help others carry the same cross. Thanks for
Oh.
helping my cousin, and God
Oh.
bless you in your journey.
Oh,
Thank
so
you,
sweet.
Abby.
Yeah.
Thank you,
That's
Abby.
Sweet.
Yeah, that's my cousin.
True. Oh,
That's
Isn't that sweet?
Sweet.
But yeah, no, I mean, going back to 2016,
Yeah.
Molly and I, we were home because we both went to the University of Alabama.
Sorry.
So sorry about that. Can I say that on here?
Dad is
Can I say that?
It's okay.
That's okay. Okay. So we came home for Thanksgiving holidays. Our PCP got us connected with Dr. Superno, who's a genetic specialist. And we got a blood test for the BRCA gene. You can get a saliva test or a blood test.
Which
for
is
it.
better?
I don't honestly know. I don't know much. I know that in general, in the medical world, both are very good and very
Okay,
accurate.
I just that was a
But
question
yeah,
I
but,
had.
yeah, no, but I honestly don't know. That
He
might be
might
something.
prefer blood, so he can do.
Okay,
you
yeah,
know,
no, we did blood, but then
Yeah.
I was like, I saw you could do saliva,
Saliva.
so that's why I
Yeah.
sent you that. I was
Yeah.
like, do you do saliva?
Yeah.
You never know. Yeah, no, but
blood.
yeah, and he did blood for us. And it was covered completely by insurance because of our high risk.
Because Mike
for
was
family
positive.
history.
Well,
And
and
I'm
y'all
sure-
having cancer, I'm sure
Yeah.
was covered, right?
especially for women. So that was like reassuring because, like my mom said, I mean, it's genetic testing is not inexpensive at
no.
all.
Yeah.
So anyway, so we got that done. We drove back to Alabama, January of 2017. I actually had a kid that I went to school with. He passed away that December. And then I had a friend who actually tragically passed away early January.
Oh, wow.
And then a close friend's uncle, who was like uncle to me, actually passed away as well. And this was in a span of 3 weeks. And
Oh, my gosh.
it was something that I'm a sophomore in college. I was in organic chemistry, which is still the hardest class I've ever taken. Dealing with normal college stuff, like what do I wear to a bar? How do can I show up to a class hungover? Is it all that fun stuff? And then I'm dealing with the grief of these 3 people, and I get a phone call from the genetic specialist saying you are BRCA positive.
Yeah.
So you just take that. And that was a lot. It was immense. And I was like, oh my gosh, I don't know what to do with this information. I don't even know where to put it in my life right now because I'm dealing with this grief. I'm dealing with college things. I'm 19.
You're 19.
It was a lot. And she was awesome. His PA, Caroline.
She was
called me,
wonderful.
and she was amazing, but she gave me so much information that I was
overload.
Like, it was overload.
Yeah, absolutely.
Because as we, talked about, the BRCA gene just means that I have an increased chance of getting all these cancers. And she explained to me, you can do whatever you want with this. You can sit on it and not get checked up. You can do these preventative measures where you're getting checked in by X amount of doctors every 6 months. You can do risk reduction surgeries, not just mastectomy, but a hysterectomy. You can freeze eggs. You can start taking preventative tamoxifen.
You have the high risk for the
ovarian.
Yeah, ovarian cancer. So she started telling me all these things.
Oh my gosh.
And I immediately, as a 19-year-old, I had
She's like, what's tamoxifen?
What's tamoxifen? Like, I don't know any of this
why
stuff.
would you?
Why would
I?
you know? Exactly.
I remember I had an organic chemistry test the same day, and I was like, okay, thanks, Caroline. Awesome, bye. Hung up the phone, and I was like, I gotta go do my organic chemistry test. I found out at that point, my sister called me. She was negative, which I think kind of like you said, it almost was harder for her because we couldn't go through it together. She almost felt guilty that she didn't get it except for me.
It's such a hard thing.
It's hard.
Yeah.
It's such a hard thing.
It's sometimes harder to be the person watching another person suffer.
Yeah.
Versus being
100%. Because then you have all the guilt, but it's not nobody's fault.
It's no one's fault.
No, it's
not.
nobody's fault.
No.
It's just, but I get it.
But
I get with the sisters. I get that.
Yeah.
So anyway, I think I just kind of took a beat. I took a couple months.
Yeah.
They were very supportive of it.
We're like, whatever you want to do.
Yeah. And they've always been like that. My mom and dad have definitely been supportive of it. They never pushed me, but they've kept me informed and have always done a good job. So I think that summer, so this was January 2017, that summer I started inquiring a little bit more about, okay, what doctors do I need to start seeing every 6 months?
Okay.
That's when I started figuring out all the cancers involved.
And so remember, she went to her OB, and I went with her only because
absolutely,
we're both hearing information. And she said, "Okay." I mean, she knew, of course, what it was, but she goes, "I think you're the youngest patient I've ever had who knows she has the mutation." So,
but you know what? That's a gift.
Yeah.
Oh, yeah.
Yeah.
No.
It sounds scary and all terrible, but thank God.
Well, and I was like, okay, this is awesome. And I'm glad you said that because that was one of the points that I realized, like, I want to be more proactive about this and I want to spread more information about this because I can't be the only person at my age that has the BRCA gene.
Right.
And more people need to get tested for it. And so I was like, oh my gosh, I'm a 19-year-old, the youngest person. I bet there's someone else in my shoes. And maybe they're just scared to get genetic testing. Or maybe they don't know enough information.
Or maybe they don't know.
Yeah. So anytime I can get the opportunity to talk about BRCA, I do, because the amount of people that just don't even know about it or or maybe they're scared to even get the genetic testing because they're unsure about the results because they don't even know what the results are going to be. So just any bit of information that I give to anyone, whether it's someone on the side of Walgreens or a nurse of mine or a friend or a patient parents
Are
of
here.
mine, here. Yeah. And
that's why I'm so
version-
grateful you came
Yeah.
because this is such a good thing to talk about. But I
Yeah.
want you to finish telling us
Oh,
about
yes, yeah.
how what made you decide to
start seeing her
So I
doctor.
started seeing my doctor. My OB was like, hey, I want you to see a breast specialist. Everett Bonner, he's in town. He's well-versed about the BRCA gene and breast cancer. He's a breast surgeon. She's like, I want you to start seeing me every 6 months to get an ultrasound of your ovaries. And once a year.
Oh, wow.
Yeah. Just to, be proactive. If you can catch it early.
And check her breast.
She can also do a second breast exam. And then also get tested, get blood work to see about my CA125 antigen, because they found that people who have ovarian cancer, that blood marker is increased when you have it. So again, my OB and the breast specialists are amazing.
They are amazing.
Doctors that have not only know information about the BRCA gene, but they keep up with the research, which is amazing for me as well. So those were the two I started looking at. And she also told me, you need to go start seeing a dermatologist every 6 months for melanoma. Also, I'm very fair skin.
Yeah, I was gonna say,
I get freckles a lot. So that as well. And then she told me, I can start going to a GI doctor to get my pancreas checked out. To be honest, I don't do that as much. I'm kind of bad about that. But that is something as well. So
because you have so much to do.
Well,
there's so much to do.
And the pancreatic cancer risk is pretty small.
low. And they were saying even the testing that they can do, whether it's ultrasound or blood work, is not as accurate for detecting cancer and for pancreatic cancer. So anyway, with that was the summer of 2017.
So you make your appointment with Dr. Bonner and
I made all those appointments in the summer of 2017. And I was like, hey, I'm going to finish out college at the least. Everett Bonner did tell me he was very awesome and very supportive, and told me that, I can't tell you what to do with your breast at all. I'm not a woman. I respect that the breasts are a huge thing for women.
Part of it.
Yeah, and I love that he said that. It was very comforting.
He did.
That was such a good thing.
But he said the chances of you getting breast cancer are very high.
Really?
And that's when we started talking about the percentages and the increased chance of it. He told me, we can do mammograms and MRIs every 6 months. But because you're so young, your breast tissue is so dense. So we're probably going to find stuff that's probably benign because you're in your 20s, but it might be cancer. So you might be holding your breath every 6 months at the appointment.
What a nightmare.
Because he would have to biopsy. She'd have to wait for results. He said for some people, it just drives them crazy. So he goes, a lot of them do that. And then tell about the 10 years before your youngest relative's diagnosis.
Yes. So the other thing that he told me that was very fascinating was he recommends that
studies show.
He recommends based on research that when the youngest person in your family's gotten diagnosed, so say they're 31, he recommends that you get a preventative mastectomy 10 years before that.
Oh, wow.
Right. So Mike's mom was diagnosed.
Oh, that's very good information.
Yeah. And I said she was 32. She might have been 34 because I remember in 24 was kind of our. But anyway, so to reduce the risk the most, you want to go 10 years before when they were diagnosed.
To prevent getting
that's huge.
Yeah.
That's good information for people.
It is very good information. And he told me at the time, because I went with her, he said, he talked to Brady about her options, risk reduction surgery. And he goes, but now I want to talk to you about your other daughter, Molly. I said, well, she's not BRCA positive, doesn't have the mutation. And he said, she is still at increased risk for getting cancer because of your husband's family history. So Molly's chances of getting it over her lifetime are in like the high 20s, I think, which is, if you think about you and I are probably maybe up to 13%. Molly's up to the high 20s.
Oh, wow.
So Molly now also goes and gets checked.
Every 6 months.
Yeah,
every
she needs to.
So just knowing that if you have breast cancer in your family, no matter what you
need to
be looking into it.
Oh, yeah. Oh, absolutely. I mean, we're so
exactly.
now, now
now you're there.
Now we're
there.
That's and now Pearl, we're
now
going to be checking her at 15.
Pearl's going to be getting the check.
Pearl's going to know what this stuff is.
We're going to be
puberty.
She is. But anyway, so he told her he wasn't going to make the decision for her, but, he went through all her options.
And he was great. And I liked him him a lot, and I saw a couple of different breast surgeons, and I
Okay.
was comforted by him the most. He listened to me, but also told me all the factors involved. I'm someone, I love information. I like knowing all the facts, and he was able to do that. So with my mom said, I was kind of looking at, because I was 20 at that point by that summer. So I was like, I want to get a preventative double mastectomy by the time I'm 24 at the latest. That was kind of my thought process. And again, my mindset was very simple. It was, I don't want to get cancer. I don't want to mess with, as y'all know, the bills, the pain, the heartache, all of that involved. And it's not just you, it's to your family. I don't want to mess with any of that. And so it was a very simple choice for me. It was very simple and straightforward. And I was like, because when you get a preventative double mastectomy, your chances go down to getting breast
like
cancer.
what ours are.
No, even less than. I have
that, okay.
less than a 3% chance of getting breast cancer now.
Let me just tell you, it's so worth it.
Immediately
There's no,
worth it.
I mean, you can't even.
No.
I mean, you saw.
Yeah, I mean, exactly. I mean,
Well, and I was proud of her decision. I was proud of her for being very firm in it. But I said, listen, you're young, and this is huge, having your breast removed. And so I had just had a friend go through breast cancer treatment. She had had a double mastectomy, everything. So she very sweetly and kindly, very dear friend of mine who has known Brady her whole life, met with Brady. And I said, you need to ask Miss Kelly.
Yeah.
Y'all two need to have the conversations. Anything that you want to know about not having, your breast anymore.
Yeah.
And so they sat down and talked before.
And I'm sure that helped.
Oh, it was so helpful to, again, talk to someone who's been through it.
Yeah, no, I mean, I can't, I'm sitting here like you're so brave, you're so smart, you're doing all, but you go and I think about when I was young like that, I mean, what do you do with all that information?
I mean,
what do you do with it all?
Yeah.
I mean, it's a lot. It's not, it's never ending. But again, on the flip side of it, it's like you did the right thing because once you get chemo in your body and once all that happens, it's just, you're on tamoxifen. It's never fun.
Exactly. Yeah.
So
and the tamoxifen for years after,
it's years. And then you pray it don't come back again.
Exactly. I know, yeah.
Because now it's in your body.
Exactly.
So you did 100%, but I mean, to be so young to choose that is so brave.
Oh, well, thank you. Yeah.
So brave.
Yeah. Thank you.
But it's the right thing. Over and over again.
I was relieved she does.
Well, no, but you had to make her you had to let her make that choice because it's her body. She's an adult. Which, I'm going to be honest with you, I don't know if I would be as nice as your mom. I'd be like, we're taking them off now. But I've been through all
but you're coming at this different.
Yes, I am coming at this different.
I mean, because you did witness a child go through, and all that, and you were thinking, hey, if I could have rewound us 10 years, this would be a different conversation.
Yes, that's where my brain's at.
And so I get what you're saying, but at the time,
Pearl has no hope.
Pearl's not going to keep those boobs.
She's not going to have any boobs.
She's not. She's going to know what a double mastectomy is.
She's getting it done right away.
Yeah.
She needs them anyways.
I love it. Yes. But yeah, my mom definitely really helped me by giving those people. Because again, having people to talk to about it. I mean, my surgeons only know so much about the surgery, but they don't know about the aftermath and what you deal with a double mastectomy and all that. So anyway, the conversations, prayers, really discerning, is this the decision for me? And I had time to do it as well. That's the other thing. Lindsay found out she had cancer May and had to get a double mastectomy in June. Mm-hmm. And as I tell everyone, I'm like, I found out about this gene in 2017 and I got really 3-4 years to decide and really discern if this was the decision for me. So I'm very grateful for that.
But it still doesn't make it any easier.
No, it doesn't.
It doesn't. It's hard. No matter. I mean, it just sucks.
It does.
It sucks. That's all I'm going to say. It
sucks. It does. And we prayed. I mean, I prayed. Brady prayed. I mean, we
and
felt
I remember
good
hearing about it.
I
I didn't even. I remember Peanut came home one day and said, "Oh my God, Brady had to get, I was like, what? And I mean, like my heart dropped. And this was before Lindsay was diagnosed.
Yeah,
Yeah.
that was before.
Yeah.
Yeah,
Right
and I was
before.
like, and I remember praying for you, and I remember thinking, like, oh my gosh, like
This is
she's
crazy.
such a baby, like your
Yeah.
baby.
Yeah, I know.
You're,
Yeah,
still,
we're
you're still
young.
baby Brady.
So, yeah.
You know, like she's still in high school.
I
You know, she's still not
know,
grown up.
it's
You
so
know, to
true.
me,
I know,
you know, I
yes.
never look at them.
No, as older. Peanuts the same way. I'm like,
Yeah,
what do you
yeah.
mean she's a
I
nurse?
know. Like, why are you doing
Why
that?
do you have a real job?
I know.
Yeah.
I know. She's a
in
big
the
girl.
hospital.
Yes, but yeah, but so fast forward to fall of 2019. I was at one of my little brother Thomas. He's 15 now, but almost 16.
Almost 16.
I can't
Oh,
believe
I know.
that.
Driving
Almost
driving soon.
driving.
I know.
I saw
Um,
pictures of them the
I know.
other day. I'm sorry, but
No,
I couldn't
know.
believe it.
I know, big. I
Getting
know.
so big and
They're the
strong.
cutest.
Thank you. Thank
I
you.
know.
But I was at his football game, and one of his friends, his mom is a nurse. For a plastic surgeon. And
Oh.
I actually was talking to her, and the BRCA gene got brought up for some reason, always
So
gets brought up.
crazy. So crazy.
And I was telling her, I was like, yeah, I had an off year after, I should back up. I had an off year after college before going to physical therapy school. And it was the fall. So I just ended school, just graduated from college. And I was telling her that I was like, no, I want to get a mastectomy. I just have to find the
Time.
right team,
Right.
and I have to find the right time for it. And she was actually the one was like, you need to start figuring out what plastic surgeon you want and what approach. And I was like, there's different approaches. Like, oh my gosh, like,
remember that.
and I was mind blown. She was like, and it's hard to get into because to go see someone and get in with them right away. So it might be wise. This was like August,
Yeah.
September 2019. She was
Just go meet with
just
them.
go meet with them. And I was like, oh my gosh. She's like, I'm not saying pull the trigger, but maybe just go meet with them.
So you did have the time.
Yes. So again,
she did.
the
That's-
time it's very precious. And as I see more people get diagnosed with cancer, even besides breast, you don't have time to make
Yeah.
those decisions and really figure out if it's the best for you. So I am very lucky. And
Yeah.
yes, it wasn't fun, but I am grateful for that because I found the best team for me to do my procedure.
Yeah, because like Lindsay, they just, I mean, look, she got to choose, but not like that.
Not like that. Not like that
Mm-mm.
at
You
all.
get to choose, but it's
You're-
kind of got to be like, okay, we got to
Like
get
this,
this.
we're
Yeah.
like this.
So I
Yeah.
finally found a team of doctors that I liked. I found
Mhm.
a plastic surgeon that I liked his approach. I was going to do a mastectomy. I was going to do a nipple sparing mastectomy. So they were going to keep my nipples. I was going to do the scar.
So they're not worried about those having the
So I do
cancer.
have a higher chance of getting cancer because my nipples are still here, but it's less than a 1% chance.
Okay,
It's
yeah.
very mild. But he was like, we can keep those. So I wanted to do that. I wanted to do implants. So we did it that way. Found it, and these are all decisions that you have to talk about with your surgeon. These
Yeah.
are, believe it or not. So I chatted with them about it. We were going to do the scar underneath. I was going to do a 2-part surgery, which meant same thing that Lindsay did. I was going to have the mastectomy first, and they were going to place spacers in the spot where my breast tissue was. And then over a course of X amount of weeks, X amount of months, they would expand those. And then when it was time, I was going to get the silicone implants in place of the spacers. So I found doctors that agreed to all of that. We talked through it
Wow.
all. And in January 2020, I got the double mastectomy to
Gosh.
prevent breast cancer.
And Dad, don't we have a picture
Yeah.
of that? Yeah.
Yeah,
let's see
so
that.
yeah, that's me in the
Yeah,
hospital.
that's in the hospital.
With my 4 drains. You have 4 drains.
You remember those?
Yeah.
I
we
mean,
have
Mhm.
I know, and having to,
Oh,
know.
yeah, to drain
Yeah.
them
yeah,
Yes.
yep,
and
yep.
dump it.
and dump
dump
it.
it.
Oh yeah.
Oh, yeah.
Oh yeah. And
Oh,
figure
yeah.
out how many liters. And
Yeah.
we had a log sheet.
Did
my
y'all
mom
log
kept up with.
sheet?
Yeah, did y'all have the thing where you sat in the tub on the seat where you couldn't get wet up the top?
I think I sat at the floor of the shower and my mom just helped me on the
Yeah.
floor of the shower.
Okay, yeah, we put Lindsay on a seat in
Yeah,
the
that
tub.
was smart.
Yeah.
That's probably smart. We did not do that.
We
Yeah.
did not. We did not do that, but we managed somehow.
Yeah,
Yes.
yeah.
So yeah, but that
There she
was
is.
the day after. So
And did you have
yeah.
the rope with the drain hole
Yeah.
or the thing, the neck,
The
neck
lanyard,
thing?
yeah,
Yeah, but that's
lanyard.
some kind of
Yeah.
thing. We had
Yeah.
something.
Yeah.
I don't
Yeah.
remember what it was.
Yeah, there's lanyards that hold the drains because if the drains pull, it pulls on your skin and it
Oh,
hurts.
Yep,
So
yep.
but so that was me. I had the mastectomy. And I actually that was, believe it or not, that was COVID. COVID hit March of 2020. So
right after this.
Right after this. And I definitely had a crazy experience with my post-operative time after the surgery. They thought I had an infection for a bit. I was on more antibiotics, and then because I was on the antibiotics, I got an infection called C. diff.
Which is horrible.
I remember that.
Yeah.
She was so sick.
Remember when I went to see you, you were like, your legs are so skinny. And I was like, yeah, because I lost all my weight. Because I can't eat it all.
I never had heard of that.
Yes.
I know.
So
And I remember you telling me, and I was like, what?
Yeah. So I got C. diff from
Like,
being on
you
antibiotics.
go through all this, and then you get that.
I know, yeah. And so I dealt with all
So
that.
annoying.
And then COVID hit, and they pushed back my surgery a bit, and then my second surgery, so the reconstruction. And then I weighed 97 pounds. And my doctor was like, you need to put on weight to get surgery.
Like, he didn't even want to put him in.
Yeah.
He was like, you're too skinny.
You're too
because
skinny.
you know, she's so muscular and
Yeah.
stuff.
I know, but I
was like-
remember that.
Yeah.
That's why I was like, oh my gosh, yeah.
And so
And I didn't mean it like that.
No,
It was just like, well, I hadn't seen it. I was like, oh my God.
We
you were
all
like,
did
Brady, where
that.
are your soccer
Yeah.
gloves? Exactly. So,
They're back.
but anyway, so I had to journey through that and figure all of that out. So anyway, through all that, I had amazing friends that were very supportive with me. And there's a picture of us. They actually showed up to my house 2 days before the reconstruction, and they all wore their bras, and they threw me a boob
You see the
party,
bras on it?
and they made me a boob
love
cake.
it. I love
So it was amazing to have
sweet.
supportive family and friends who. Really, no matter what decision I made, they were there. I mean,
That's the best thing because, you don't realize, like, how much you depend on people until, like,
Yes.
this
that happens.
Yeah.
And how much you need it too. It
Well,
was so great.
and just the God moments of, that she was sitting next to Mimi, the nurse that helped her navigate, and then Mimi really walked her through her reconstruction
she actually
and
ended up
post-op
being
stuff.
the
she
nurse.
was such a
Yeah.
godsend to us, and
Yeah.
she's a good friend of mine. So
Really, that's amazing.
But she ended up being the nurse of the plastic surgeon. So she was one of my rocks through it all. Whether it was, oh my gosh, I can't even get out of bed because I can't even hold my head up. I'm so exhausted. Or I ended up in the ED again, the emergency room again, because I'm so dehydrated from this, or my chest hurts, or hey, one of my drains has blood in it. What do I do? She was there through it all. I had really bad pec spasms, and she was there through it all with that too. So anyway, I had a definitely great team. But this was May 8th, actually my sister's birthday. I finally got the reconstruction surgery. So this is me recovering from home after that. So yes.
And
her
then
couch, she slept on that couch
For months.
That's
what
her bedroom was like
Lindsay.
literally 10 steps there, but that was her comfy spot because of how it supported her.
Yeah, so I definitely, you know this with Lindsay, the angles that you need to get to be able to sleep, because you have to sleep upright. You can't lay down.
hard.
You have to find the angle. And I told everyone, I'm like, that L couch, it was perfect. And I like the boppy pillow. I gave Lindsay the billow pillow.
Yeah.
All the pillows matter. When
The
you
pillows
matter.
They were huge.
Huge.
And then that picture had a little stitch that Patrick brought
My
her to
little
help
brother.
her feel better.
Yeah.
Oh, that was so sweet.
So
He was worried. His
Oh,
Stitch is going to watch over you.
Oh, Lindsay used the recliner thing. Remember
yes,
that?
which is great.
Yes.
And I told her that's great.
That's whatever you
Well,
can.
whatever works
And
to
the
support
pillows
you.
to
Yeah.
support you.
You have to figure it all out, because it's definitely uncomfortable.
And you can't, and then you got to tell people you can't look, because I know Pearl would lay in between her legs because she was 2.
Yeah.
You go from holding your kid to never.
Yeah.
You
And I
can't hold
remember
your kid.
Lindsay was like so sad because she couldn't hold Pearl, and
Remember
Pearl didn't
that?
understand that. You know?
Remember that?
It was
That was
so
sad.
sad.
Pearl.
It's
But-
tough. And
But it is tough.
It
it's
is
tough.
very.
And that's the
But
thing.
you can't do anything. You're so independent too. I mean,
Yeah,
my God.
exactly.
I mean,
hello. Exactly.
I know. Like, I
Yeah.
can't even imagine. Like, you can't. Your mom. You're dependent on everyone.
Oh yeah.
Oh, gosh, yeah.
My mom would come in
Bathing,
and
feeding
Yeah.
you.
I had to
everything,
do
everything.
so much for exactly.
she opened the curtains every morning.
Yeah, I mean,
she,
and-
yeah.
And she'd say, "Can you open the curtains for me?" I
Can you
said,
do
"Of
this?
course,
Can you,
that?"
like, can you help me put a jacket on? Any of that. So all the things, and yeah, it's definitely a humbling experience for sure.
Yes.
So
So I wanted to say that she has a blog. I kind of wanted to pull the blog up. I know we're having something. Nobody needs to see my face anyway. So
I know, Lori, where are you?
we all know what I look like.
Yeah. We got honey. We got honey on the brain.
Oh, we got honey. So don't worry about that. So tell us about your blog. Is it a blog or is it a website? Tell me.
It's a blog. The website is called bradymoran.wordpress.com.
Okay.
But it's a blog on that website.
Okay.
And, basically I created this blog because during the recovery, which takes a long time, takes, in my opinion, over a year, to fully, just go through all the motions and stuff.
And this is with not having cancer.
Not having cancer, yeah.
So, I hate to interrupt you too, but I have to say, tell everybody, this is the one thing I remember you saying, you don't have feeling.
Oh yeah, so everyone's different with feeling post-operative.
I don't think
with
Lindsay
mastectomy.
Does really either.
Yeah, so again, something that we should know because we're women, but we don't. Your breast tissue goes all the way up to your collarbone. It goes, all the way down here to one of your ribs. It can be in your armpits, on the sides of you as well. Everyone's breast tissue looks different and where it is.
Okay.
So when they go to remove it, they're taking some of those nerve endings out.
Oh, look, Dad put it up there.
Oh, perfect. Yes, that's the website. Yeah, please check it out or send it to anyone that you know.
Okay.
Anyway, so when you go take the breast tissue out, everyone's nerves endings look different. So for some people, they go to take your breast tissue out, and some people, like my mom's friend, Miss Kelly, she has some feeling in some places, but other people can have no feeling in certain areas at all. For me, my left side has been the worst. I cannot feel underneath my armpit at all, or part on this side or on my back here. But pretty much from collarbone down, I can't feel at all. And some people get it back.
That's good to tell women.
Oh, yeah.
Oh, yeah, exactly.
Absolutely.
I mean, you're going to have to, these are all just things that we take for granted. But.
Yeah. And it definitely, that was something that was very emotionally.
Did you know that before?
No, I didn't know that. The other thing I did not know is the way I did my implants. I did it where they call it under the muscle. So they had to pretty much detach part of my pectoris muscle.
Oh gosh!
And reattach it, and so I have a torn muscle on both sides.
Are you in so much pain?
Well, no, I'm not in pain, but
oh my gosh,
sounds yucky.
Yes, but I have spasms, and that's been the issue through it all. So I have spasms, and because my pec is torn, I think it just sometimes has been hard to reacclimate with it partially being torn and some of the nerve endings changing. So that's something I wish I knew before as well. And those two things are something that I advocate to women who are about to get the surgery a lot. I'm like, I just want you to know this, because those were two things to change. There were big changes for me because I'm in my 20s. I work out all the time. I'm doing a bunch of stuff, and I'm like, oh my gosh, I can't feel my chest, a big area of my body, which was crazy.
That has to be and I know Lindsay will say stuff like that every once in a while, like, oh yeah, I don't feel anything.
I don't feel anything. Oh yeah.
And she'll joke about it, and I'm like, and it's like, God, you just don't even think what happens,
right.
All this stuff happens to them, and you don't realize all the things. That's why it's so important to educate everybody, but not that you wouldn't have not done it.
No.
But
it's just psychological in a way when you can't feel something that you had no idea was related, that was going to happen from you obviously know, okay, I'm losing my breast, but to be numb in a spot, it's that's a freaky feeling.
It is a freak. And I think about that. And even and I say with Lindsay or somebody that has cancer, you have to do it. You get it out. You kind of do. This is kind of something you chose to do as a preventative. I just feel like it's a different thing because it's maybe, you're probably on the fence a little. Maybe it wouldn't happen. Maybe, you know what I mean?
Or maybe I would do a different approach.
Yeah, it's hard in that fact because it's you're kind of surviving in the other thing. You just do what you got to do. And it's almost easier to just do it.
Right.
Yeah. You don't have to think about all these
You don't have to process all this stuff.
You have to process the stuff. Exactly. No, you're right.
And sometimes it's easier. And I always say that. I had my kids when I was young, and I was like, ignorance was bliss.
Yeah.
All these moms and dads now, I'm like,
I know.
Look at that.
You don't even know. My kids were fine.
Really?
All of
Peanut
them
was
were
just
good.
Peanut survived.
She did. Look at that, Lori. She did.
But there's all these things now. And I was
Yeah.
I remember meeting parents that were older than me that had kids my age, and I was just like, really?
Yeah.
No, I didn't know that. But so you had time to process all this
Right.
information.
Yeah, and while I had time to process, like I said,
So sometimes that's harder.
Yeah,
But
it's
it's
hard,
a
yeah.
gift.
Yes,
but then
it is a gift.
But it can be harder.
Yeah.
Yes.
It
And,
definitely can be.
Yes.
Yes, but like I said, and why I started the blog and stuff is a lot of information I didn't know beforehand.
Yeah.
And so kind of like throughout my recovery.
Yeah, pull that blog up again. I want to pull that up since we had some technical difficulties, guys. Sorry. So we can kind of go through your blog a little bit.
We just couldn't see you, that's all.
Dad, we
That's
don't need to see me.
That's all.
Broke the camera.
But that's exactly right. Exactly right. But yeah, so during, again, from January 2020, kind of the whole year till January 21, I'm a big I journal a lot. I'm big into that. And so I kind of just wrote down all the things, you know, emotionally, information wise, things I didn't know about, all that. And so, anyway, I made a blog out of it to decide to share with people.
I love that. I started reading it. I got here, and that's when I first time found
Yeah.
out about it. I was like, oh my gosh.
No, please share it. But yeah, I have several posts on it. The one that he's scrolling through right now is actually one that I did almost 2 years later, I think. And kind of talked about my new normal and these things that people don't talk about after a mastectomy.
Nobody
that still
talks
affect yeah, they don't, because you know they don't talk about it.
Well, like you said, for people with cancer, they have no choice.
Yeah.
So, you know,
But I know, but still, they should talk about all these things because this is really
it's
tough.
big. Well, and it's the little stuff, and it's something like you said with Lindsay. Like I'm like, oh, someone spilled like hot wax on me. I can't feel it. I just got burned. Like, oh my gosh, like that's a big thing. Like, you know, something like that. Or, oh, I went to go push down on the soap dispenser and my muscle spasmed and now I can't work with my kids this afternoon at my job. Like there's these little things. And so anyway, there's all these things. One of the things up here is I put products to have them recovering from a mastectomy.
I saw that. I was like, oh my gosh.
Yeah.
So wait, so I was thinking you said the plexus or melaleuca.
Yes.
I have a friend that sells that
Yeah, and
melaleuca. It's really good.
Yeah,
right?
they're probiotics.
Yes.
And that's what helps prevent C. diff, one of the things. But
Really?
probiotics,
Yes.
that's why I put that on there.
So because like I didn't know about C. diff.
Yeah,
I'm sorry.
And that's something when you're on antibiotics
yeah.
for a long time, you're at a higher risk.
No, absolutely.
So,
okay.
so products are on there. My story's on there. Information about the BRCA gene. I actually put 2 journal entries.
I love that.
There. I put a timeline of kind of my year long of what was happening. With advice, because I think I'm a visual person. So I think sometimes people go, oh, I'm getting a mastectomy. I'll be out of work for 6 weeks and then I'll be good. No, there's stuff going on.
You know.
And there's advice on there. There's research about the type of implants you can do or reconstruction. There's little tidbits
Brady, I'm so
that
impressed.
I love this one. It's called Things That Are Unexpectedly hard about a double mastectomy.
I love that.
Which is one of my favorites that I wrote. But yeah, so
this is such a gift that you just gave people.
Oh, thank you.
You know, it really is. And a change of perspective.
Yeah. And this one too, I wrote kind of to anyone. Anyone can read it. Not if you know, even if you don't have breast cancer or the BRCA gene, but it kind of just talked about my change in perspective since having this surgery. And yeah, so.
Yeah, so, and I don't mean to be, if I'm out of line, say no. So, like with the ovarian, do they want you to eventually
get a hysterectomy? Yes. So I've actually this past fall, so what are we in? 2024. So fall of 2023, I actually went through the process of freezing my eggs. Which was something that I think I told you all about in the beginning, is a preventative measure. So my OB said, look, heaven forbid you get ovarian cancer before you're ready to have kids. Heaven forbid you get it in general at all. But if you get it before you're ready to have kids, it might be a good idea to freeze some eggs and put them to the side. So in case you do get ovarian cancer, you have your eggs at least.
Because you can't, they would have to take the ovaries, obviously.
No, but that's just such a thing. I mean, like, just so, like, is it like the breast cancer where you have to wait to a certain, where they're saying you suggest to get it, like,
so, again, and I think it was Bonner that told me this, but he says anything, any type of cancer that has you have a chance of, like, a higher than 40% chance of getting is scary. So he's like, that's something that's alarming to doctors. If you have a 40% chance of
and what
higher,
is yours?
So it's up to a 45%
up to
chance.
45.
for ovarian.
So after she gets married, after babies, they're probably
So anyway, point being is
Then we gotta get you married.
No, so my OB, we've talked about it. She's like, I want to give you, if I had to give you an age, no, and I want to be married to you. Thank you guys. I got all the prayers and the support in the world.
Everyone's
looking. Everyone's looking.
While you're stalling for
Keep looking for me.
If anybody knows.
Seriously.
lady.
And Peanut gets so mad because I try to set her up with somebody, like somebody's brother or something that came on the show. She got so mad.
Like, I got
at least
this,
you're trying.
Mom.
I'll never stop people from trying, but no. My doctor was like, by 35, we really need to start looking at it.
Okay.
If you are not done having kids, maybe we can look into something else. But when I get pregnant, those hormone levels can increase my chance of getting cancer as well. And that's something to think about as well. I don't think people realize that with the BRCA gene is,
there's
again,
so many things.
Everyone's exposed to cancer genes all the time. I mean, cancer cells all the time. So these other factors are increasing your chance as well. So it's not just, hey, Brady, you have potentially a 45% chance in your lifetime to get this. It's like, well, make sure, you're not drinking wine or eating, this or XYZ or putting this thing in your body.
So is wine bad too?
I mean, there's some research. I'm not going to talk about
that.
Alcohol.
Alcohol. Lindsay hardly ever drinks now. I mean, it's just so many.
Exactly. Well, you never know. That's the other thing. You have all these research out there that we don't know. So I'm like, oh my gosh, this is another thing. So anyway, by 35, definitely by 40, I will have a hysterectomy. They've talked about it though. Like I told you, that we might think that it's fallopian tube cancer first. So there is
fallopian tube.
Yeah. So you can get those removed and keep your ovaries and uterus for a little bit longer. So I might do that. I'm kind of
that way you keep the hormones, in your body, and
that's so hard to because
I know.
Exactly. So yes, but I just turned 27, and so I talked to my OB again. A conversation we've had since 2017 about egg freezing, and she's like, you're at peak egg count amount at 25. And after that, everything kind of goes downhill from there. So, and we found out from the fertility specialist that the quality of my eggs and the quantity are lower because I have the BRCA gene. So he's like, that's something that it's new information all the time. It's new information, I'm telling you. So that's why I was very happy with doing that.
It's just like one thing after another, after another.
New research every year.
But again, knowledge is power.
It is.
But yes, that's when I tell people, everyone's like, oh, you got the mastectomy in 2020. You're good now. I'm like, no, I am not. There's still things that hit me and new things going on.
And I love that we discussed this because I'm going to tell you, just educated me tonight. There's so much I did not know.
Okay.
I was kind of ignorant thinking, she's okay now.
Yeah.
She didn't have to worry. No, you got a whole slew of things.
She's got to keep worrying.
Yeah. You got to keep worrying. You got to be proactive.
Yes.
Right.
And
you have to. And
you
I don't
have
think,
to.
I mean, like the story I told you earlier, my mom's 81 and she was told she doesn't need to have mammograms anymore. And then a friend of mine's mom got diagnosed with breast cancer at 86.
You hear that, people?
And so I know,
86.
I called my mom. I said, and I told her. Of course, I didn't have to tell her twice. She went the next day and got a mammogram, and
Good
she's
for
like,
her.
"I'll be doing that every year of my life." I said, "Exactly." I mean,
why wouldn't you?
Why wouldn't you? People are living longer. I mean,
I know,
a lot longer.
Your insurance pays for it.
Your insurance pays for it.
Then
And
why
it's just checking. It's
just
checking.
It's preventative care.
Exactly.
It's all about being preventative care.
Oh,
I mean,
absolutely. And as we talked about it before, I think you're young in your 20s and you think, oh, I'm invincible. Or I'm worried too much about my job. I can't take off of work to go get mammogram. Or, oh, it's my yearly. I'm just going to push that back.
Yeah.
I'm just going to push it back because my kids. Yeah,
we
exactly.
almost did that. We almost did that.
And I think it happens in so many women. And it's not like bad excuses. It's, well, hey, my kid needed me or he was sick and stuff. It's like, yeah, but you got to learn how to prioritize yourself because if you don't do it.
So glad you say that because you have to do that. It was during COVID for Lindsay and that they were just seeing patients again. And she's like, no, Mom, I don't want to go. The line's going to be so long. I said, Give me the kids. Go.
Yeah.
Thank God she went, because if she would have waited, it went straight to her bone.
Of
Yeah,
course,
it
it would
would
have.
have.
Yeah.
Absolutely.
So, like, you have to always get checked.
Yeah.
And then we
Yes.
can't say that enough, to, especially to young
Yes.
women.
Yeah.
Right.
Absolutely.
Right.
And as we talked about before, like Lindsay and I are healthy people, you know,
Yeah.
young healthy
Y'all
people.
are.
And
It's
so
so crazy.
I think people go, "Oh, I'm young,
Good
healthy.
lifestyle choices, right.
I'm good.
Yeah.
I make the right decisions. I can't have that." And but you can.
But you
Yeah,
can.
you
I
can.
know. I know.
True.
Well, I just appreciate y'all coming so much. I
Yes.
think this, Dad, what do you think? Do you have any questions? I'm sorry.
Oh, I was just so amazed by the story, and even as a man, I can relate to it somewhat because I was diagnosed with prostate cancer about 12 years ago,
Gosh.
and you know, you're not even sure what it means when you hear it. And then you have this sit down with the doctor, and the doctor gives you all of these choices, none of which sound appetizing.
No.
you know,
Yeah.
and and I know I was particularly intimidated by a couple of things. One was I had a friend who had a particular treatment done, and it set him back in a lot of ways.
Right.
So I didn't want to go with that.
Yeah.
And the thought of watchful waiting was just like
Yeah.
scary as heck.
Mhm.
So we went for getting it done right.
Right.
But
Okay.
still, it's not near the risk and consequences that women face with the breast cancer, unless you let it go too long.
Right.
Yeah.
Right.
And I did have a friend at work who his family. So this is back to this idea of family history and stuff like that. And he had a brother who had gotten prostate cancer, and his father, I think, had it. So he knew he was on the list, and so he was, getting tested way early, and
Yeah.
and was able to deal with it way ahead of time. So it's that dilemma of knowledge is power, but knowledge is scary.
Yeah.
So-
Knowledge is
Yeah.
scary.
Knowledge is scary.
Yeah, so
is.
do you really want to know? And
Yeah.
it depends, as you said earlier, on what you think you're going to do with the information. You
Yeah.
know, so that kind of thing. So I was helped by the knowledge, so that helped a lot. But
Yeah.
but your story is great, the way you handled it, and
I know. I'm
She's
so proud of
amazing.
you.
Thank
She
you.
is.
Thank
She's
you.
amazing.
using both faith and reason to try to maneuver
Yeah.
through all of the
Absolutely.
challenges. So
Mhm.
we're very proud of you, and thanks for being here.
Yeah. Well, thanks for having us.
I know.
This is
Yeah.
awesome.
I know. It was fun.
Feel
It
like-
really was
Yeah.
fun.
Like,
I know.
show.
Get to be in my old bedroom.
As a guest star. Oh, yeah.
I know.
With your Prince
I know. So thank y'all so much for coming. So,
Oh,
Dad,
Yeah.
what do we got going on next week?
Well, it's going to be a strange episode, I think. Okay.
It is gonna be strange.
You're going to be interviewing two gentlemen who are going to be starting a podcast, basically, or a channel, and the channel is going to be about faith in crisis. So I'll hold all the punchlines for you for next week, but it's going to be a couple of gentlemen. I'm one of the two, so.
Oh.
But Honey's going to interview us, and we'll do that next Tuesday. And
I
it's
didn't get invited to be on that podcast.
well,
I'm
you're
gonna start my own.
You need to start my
own.
honey
I
podcast.
am. I'm gonna start my own.
we're always willing to have guests on, especially
Yeah.
those with opinions.
No, you have a few of those.
Yeah, so that's next week. So we're inviting everybody to come see that too.
Awesome.
So thanks again for being here tonight, Brady and Tammy, and we'll see everybody next week.
See you
God
next
bless.
week.
Thank you.
Bye.